Section 1. Understanding bed sores. A simple introduction. Bed sores, or pressure ulcers, are injuries to the skin and the tissue beneath. They occur when constant pressure on one area blocks blood flow over time. Common pressure points include the heels, hips, and tailbone. Reduced blood flow starves the skin of oxygen and nutrients. Without that supply, skin cells begin to die and a sore forms. Pressure ulcer, skin injury caused by constant pressure. It is also called a pressure sore. Another term is decubitus ulcer. These names all mean the same condition. Knowing what they are is the first step to preventing them. It also helps you act early if one appears. Bed sores are a serious medical issue that needs careful attention. They are not a rash or a minor skin irritation. Without treatment, they can become deep and very painful. Damage may extend down to the muscle. In severe cases, even to the bone. Deep sores raise the risk of infection and whole body complications. Section 2. Stages of bed sores. From early signs to deep wounds, bed sores progress in stages. Understanding the stage shows how severe it is and what to do next. Clinicians classify by depth, tissue damage, and visible skin changes. This framework helps guide safe, timely care. Stage 1. The earliest warning. Look for a patch that looks different from nearby skin. On light skin, it appears red. On darker skin, it may look blue or purple. Press gently. If the color stays after you lift your finger, it likely meets stage 1. The skin is intact, no open wound. The area may feel firm or soft, warmer or cooler than nearby skin. Itching or tenderness is common. Without prompt care, stage 1 can progress to stage 2. Stage 3. More serious. The sore extends through the top layers into the fat beneath the skin. It may appear as a deep hollow in the skin. You should not see muscle, tendon, or bone at this stage. Yellow dead tissue, called slough, may cover parts of the wound bed. Infection risk rises sharply. Pain is common, but people with nerve damage may feel little or none. This stage needs medical care for cleaning and proper dressing. Treatment supports healing from the bottom up. Stage 4. Deepest and most severe. Muscle, tendon, or bone may be visible. Damage reaches the supporting structures under the skin. There is a very high risk of infection, including bone or bloodstream infection. Dead tissue, sometimes dark, may cover parts of the wound. Unstageable. The base is hidden by dead tissue, so true depth is unknown until it is removed. Deep tissue injury. A closed area that looks like a deep bruise. The skin may be intact, but damage lies underneath. All of these require urgent medical attention. How bed sores affect your body's balance. Bed sores upset the body's balance by restricting blood flow. When you sit or lie in one position too long, pressure compresses tiny blood vessels, so less blood reaches the skin. That means skin cells get less oxygen and fewer nutrients, like glucose and amino acids, making it harder for them to produce energy and repair damage. Without that supply, tissue begins to break down and die, creating an open wound. An open sore weakens the skin's barrier and gives bacteria a direct route into the body. This can lead to serious infections, including sepsis, a life-threatening reaction where the body's response to infection damages its own tissues and organs. Bed sores strain your body's nutrition and metabolism. Healing turns routine needs into heavy demand. Repairing tissue, especially deep wounds, burns a lot of energy and building blocks. Your body works non-stop to rebuild and defend. Protein, calories, vitamins, minerals. If you are ill or eating too little, your body may lack these extras, slowing repair. Support with balanced meals can help. This can start a loop. Malnutrition slows healing, and slow healing makes nutrition needs climb. The effort to heal uses up limited reserves, leaving you weaker and more vulnerable. Chronic wounds stress the whole body, not just the skin. Pain and infection strain your heart, your lungs, your immune system. Stress hormones, cortisol and adrenaline, rise. They raise blood sugar, dampen immunity, and can slow healing. So people with severe sores often feel tired, weak, unwell. This overall decline makes healing harder and invites complications. That is why prevention protects more than skin. It protects whole body health and well-being from a cascade of harms. The main cause of bed sores is unrelieved pressure on bony points, tailbone, hips, and heels. Prolonged loading compresses tiny blood vessels, cutting off oxygen and nutrients. Without that flow, skin cells die and an ulcer begins. Two other forces increase risk: friction and shear. Friction is rubbing, dragging skin across sheets or clothing that scrapes the surface. Shear happens when skin stays put, but deeper tissues slide, like when you slowly slip down in a bed or chair. Both injure skin and blood vessels. The biggest risk is immobility, being unable to change position. Older age, poor nutrition, incontinence, diabetes, and poor circulation all raise risk. Loss of sensation or feeling also increases risk because early warning signs are missed. Prevention matters most. Relieve pressure on your skin often. Make it a routine. Stick to it. Set reminders so you never miss a turn. In bed, turn at least every 2 hours. Set alarms. In a wheelchair, shift weight every 15 minutes. Keep a written turning schedule and follow it. Ask a caregiver to help track times if needed. Use pressure redistribution mattresses, overlays, and wheelchair cushions to spread weight evenly. Get the right size and fit for you. Practice daily skincare. Inspect high-risk areas. Look for redness or color changes that do not fade after pressing with a finger. Keep skin clean and dry. Use a gentle cleanser and pat dry. Apply moisture barrier cream when wetness is likely. Manage sweat and incontinence quickly. Eat enough protein, calories, vitamins, and minerals. Drink plenty of water. Choose lean meats, beans, dairy, eggs, nuts, fruits, and greens. Good nutrition strengthens skin and supports healing. If you identify a stage 1 sore, or a very small, shallow stage 2, you may begin basic home care while you contact a clinician for guidance. Your first priority is complete pressure relief from the affected area, immediately and consistently. For heels, place pillows under the calves to float the heels so they do not touch the bed. For a mild open wound, clean gently with saline, sterile salt water, if instructed by your clinician. Use the dressing type your nurse or doctor recommends to keep the wound clean and moist. This supports healthy healing. Do not use donut-shaped cushions. The ring concentrates pressure at the edges, reduces blood flow, and can worsen the sore. Bed sores matter because they cause significant pain and can lead to serious illness. An open wound gives bacteria a direct path into the body, raising the risk of hard-to-treat infections. For people who are frail or immunocompromised, this risk is much higher. Deep pressure injuries can take months or longer to heal. The process can be exhausting physically and emotionally. Prioritize prevention and early action to protect comfort, health, and quality of life. If a bed sore does not heal or begins to worsen, seek professional care. Advanced treatment has 3 goals: clean the wound, control infection, and support healing so new, healthy tissue can grow. A key step is debridement, removing dead tissue from the wound so healthy tissue can form. Clinicians may also flush the area, and if there are signs of infection, prescribe antibiotics to fight the germs. For deeper wounds, negative pressure wound therapy, or a wound vac, uses gentle suction to draw out fluid, protect the area, and help pull the wound edges together so it heals faster. Negative pressure wound therapy, or a wound vac, uses gentle suction to remove fluid, reduce swelling, and improve blood flow, creating the right conditions for new tissue to grow. For severe wounds, surgery may be an option. A surgeon first performs debridement, removing unhealthy tissue, then closes the wound, often with a tissue flap. This is a major step, followed by careful recovery to protect the site. Let's wrap up. Prevention beats treatment. Every time, you can protect your skin and the skin of those you care for. It starts with daily habits. Make it a simple routine. Keep moving. Change positions. Follow the 2-hour rule in bed and the 15-minute rule in a chair. Use pillows and foam wedges to offload bony areas. Regular pressure relief is the #1 way to stop bed sores before they start. This simple habit makes a big difference. Second, check the skin every day. Build it into your routine, like brushing your teeth. Inspect pressure points: hips, tailbone, heels, elbows, shoulders. Watch for changes in color, texture, or temperature. If a spot stays red or dark and does not blanch when pressed, act fast. It is your earliest warning sign. Remove pressure and contact your care team. Your simple action list: move often, check your skin daily, keep skin clean and dry, and eat well. But know when to ask for help. Seek care if the skin breaks, redness spreads, the area feels warm or swollen, there is pus, fever, a bad smell, or pain worsens. If it does not improve within 24 to 48 hours, call your clinician. Deep wounds always require professional medical care. Stay proactive. Your steady steps help keep you safe, comfortable, and well.